Welcome to your total joint replacement class. We are excited to help you prepare for your upcoming surgery. Our team at SSM is here to work with you through your joint replacement journey. St. Mary's has worked diligently to receive the gold seal of approval from the Joint Commission for our total joint replacement patients. Our hospital goes through a certification process and takes additional steps to improve and provide excellent patient care. This is a reflection of our commitment to providing safe and quality patient care to you and your loved ones. You will meet different people throughout your surgical process that represent your joint replacement team. We all work together to customize a care plan with you and support you each step of the way. Our goals for your optimal recovery include safety, mobility, infection prevention, and the prevention of complications so we can get you back to doing what you want to do. We will start by talking about the total knee arthroplasty, otherwise known as a knee replacement. The goal is to decrease pain and increase movement. Instead of a literal replacement of your knee, your surgeon removes cartilage and some bone damaged by arthritis or injury and resurfaces your thigh and shin bones with metal and plastic parts. You can think of this as a resurfacing surgery. The pieces are individually packaged so your surgeon can ensure the best fit for your body. You will have an 8 to 10 inch incision down the middle of your knee. Next, we will talk about a total hip arthroplasty, otherwise known as a hip replacement. The goal is to decrease pain and increase movement. Instead of a literal replacement of your hip, your surgeon removes cartilage and some bone damaged by arthritis or injury and resurfaces your thigh and pelvic bones with metal and plastic parts. You can think of this as a resurfacing surgery. The pieces are individually packaged so your surgeon can ensure the best fit for your body. You will have a 10 to 12 inch incision down the side of your thigh bone or across your thigh bone, depending on your surgical approach. Finally, we will talk about total shoulder arthroplasties, otherwise known as a shoulder replacement. The goal is to decrease pain and increase movement. This surgery is for patients that have a normal or intact rotator cuff. Your incision will be made on the front of your shoulder. If your rotator cuff has arthritis or damage that cannot be repaired, you may be having a reverse total shoulder arthroplasty. This surgery can also be used to treat shoulder fractures. Your incision will also be made on the front of your shoulder. Support for surgery. You will need help at home after surgery. Expect to have someone drive you home and stay with you for a minimum of 2 days after surgery. You will need additional support to drive you to therapy appointments and be a contact for you. This support person can be a spouse, child, grandchild, neighbor, friend, or trusted person. To make sure that your body is healthy for surgery, the surgeon may ask your primary care doctor, cardiologist or heart doctor, or dentist to clear you for surgery. After your total joint replacement, you will need to take an antibiotic before any future dentist appointments, including cleanings, to make sure your new joint replacement parts do not become infected. You will need to go to a pre-admission testing or PAT appointment before surgery. This is located at St. Mary's, and you will check in at registration next to the outpatient entrance before the appointment. At this appointment, you will review your health history, surgical history, and medication list. You will have lab work done, including an EKG and a nasal screening for bacteria. Anesthesia will see you at this appointment, depending on your history. You will be given your pre-surgical soap with instructions. Please bring your updated medication list, including medication name, dose, and frequency, advanced directive paperwork if you have it, and any bladder or nerve stimulator remotes. Your pre-admission testing nurse will review and discuss medications that you need to stop prior to surgery. You will need to stop taking blood thinning medications before surgery. If your primary care doctor or cardiologist prescribed a blood thinner like Eliquis, warfarin, etc., please call them to discuss when they want you to stop taking this medication before surgery. If you are interested in filling out paperwork for an advance directive or healthcare directive, our hospital staff can assist you with this. If you already have a completed and notarized advance directive, please bring a copy to the hospital so we can scan it into your chart. Having a good nutrition routine at home can help prevent infection and keep you strong and healthy during the recovery process. It is helpful to go grocery shopping and meal prep before your surgery so you have healthy and easy meals to eat at home during recovery. If you do not have a big appetite after surgery, try drinking nutrition supplement drinks like Premier Protein, Boost, or other store brand options. Constipation can be a big concern after surgery. This can happen from inactivity, poor nutrition, or from narcotic pain medications. We recommend that you get ahead of this before surgery by eating healthy foods, drinking plenty of fluids, or starting an over-the-counter medication like Miralax or Senna. Your joint replacement guide has pre-surgery exercises that we will review to help strengthen your muscles prior to surgery for knee or hip replacements. We recommend that you complete these exercises 2 to 3 times per day with up to 20 repetitions each. Ankle pumps. Bend your ankles up and down, alternating your feet. Gluteal squeezes. While lying flat, squeeze your gluteal muscles as tightly as possible while counting aloud for 5 seconds, then relax your muscles. Heel slides. While lying flat, bend your affected leg and pull your heel toward your buttocks. Lower your leg slowly to the extended position, sliding your heel along the bed. Abduction and adduction. While lying on your back, slide your affected leg out to the side. Keep your kneecap pointing toward the ceiling. Gently bring your leg back to the midline position. Prepare your home before surgery to help prevent falls. We recommend removing throw rugs, removing electrical cords and chargers from walkways, clear paths to common living areas, ensure that you have adequate lighting, grocery shopping and meal prep, refill routine medications, and anticipate discharging home the day after surgery. If you are scheduled for a total shoulder replacement or a reverse total shoulder replacement, we have additional steps to follow. We want you to stop shaving or waxing around your shoulder 5 days before surgery. When you go to your pre-admission visit, you will receive benzoyl peroxide gel. We will have you use it 5 times starting 2 days before surgery. So 2 days before surgery, you will do 1 application in the morning, 1 application in the evening. 1 day before surgery, you will have 1 application in the morning and 1 application in the evening. And on the morning of your surgery, you will do the final application to make a total of 5 applications. We will give you instructions of how to incorporate the benzoyl peroxide gel with your surgical soap. The gel should be lightly applied, not scrubbed on. It can cause some skin irritation if you scrub it too hard. You will receive both the surgical soap and your benzoyl peroxide gel at your pre-admission testing visit. The day before surgery, please pack your overnight bag. We recommend bringing only 1 set of clothes, sturdy tennis shoes to work with therapy, necessary toiletries, a CPAP or BiPAP machine if you use one, prescription eye drops or inhalers, your driver's license, medical insurance card, and a co-payment for discharge medications. We want you to pack as light as you can. You will be given soap at your pre-admission appointment that should be used the night before and the morning of your surgery. Please change into clean pajamas and clean sheets the night before your surgery. Pets should not sleep in your bed the night before surgery. We do not want you to eat any food after midnight on the day of your surgery. At the pre-admission visit, you will be given instructions on how long you can drink clear liquids. We do want you to drink 2 20-ounce electrolyte drink bottles the day before your surgery. That includes Gatorade, Propel, any electrolyte drinks that you can get from the store. If you are a diabetic, we recommend drinking the zero sugar options. If you're a diabetic, please do not drink regular electrolyte drinks. We want you to have the zero sugar option, please. On the morning of surgery, you will shower one more time with your surgical soap. We do not want you to eat anything after midnight on the day of your surgery. You can have clear liquids until 3 hours before your surgery. Patients are encouraged to drink one 20-ounce electrolyte drink on the morning of surgery. If you are a diabetic, we want you to drink a zero sugar electrolyte drink on the morning of surgery. Again, at your pre-admission visit, they will tell you when you need to stop drinking clear liquids on the morning of your surgery. We do not want you to be wearing any jewelry, hair accessories, lotion, deodorant, makeup, or nail polish on the day of surgery. Arriving to the hospital. Park in the outpatient parking lot and enter the outpatient entrance. If you arrive before 6 a.m., turn left and take elevator B to the second floor. Use the phone at the same-day surgery desk to check in. If you are arriving at 6 o'clock or later, turn right and check in at registration. This picture shows the front desk of the same-day surgery department with the phone to check in if you are in early surgery. This picture shows a glimpse of the same-day surgery waiting room. As you enter the pre-op area, you will see our Joint Commission certification wall with our gold seals for our joint replacement program. You will meet with our anesthesia team on the morning of your surgery, whether you met with them at PAT or not. This provider will work with you to recommend the best anesthesia plan for you based on your history and type of surgery. General anesthesia. A medication is administered through your IV. After you are sedated, a tube is placed in your windpipe to help you breathe during surgery. It is removed after surgery when you are safely breathing on your own. Your throat may be sore and you may have a hoarse voice for a short time after surgery. Spinal anesthesia. A medication is injected into the space of your lower spine to produce numbness and loss of pain and sensation during surgery. Medications to help you relax will also be administered through your IV during surgery. An interscalene block is a medication that is injected into your shoulder to produce numbness during surgery and provide post-operative pain relief. Arm numbness or the inability to use the arm is common and may last a few days after surgery. Exparel is a long-acting numbing medication injected at the surgical site to help with pain relief. You will have a bracelet on your wrist. Please leave it on for 96 hours after surgery. It reminds healthcare providers that you have had this medication and to avoid any additional local anesthetics until the 96 hours are over. We have rooms dedicated to you and our joint replacement patients on 5 East. Our therapy gym is located on this floor, along with orthopedic trained nurses and patient care techs. What to expect after surgery. The surgeon will speak to your support person after surgery with an update. You will be transferred from the operating room to the recovery room and then transferred to an inpatient room once you are ready. Polar Care ice machines or ice packs will be applied to your surgical site. The Polar Care machines use ice water that circulates to your surgical site to help with recovery. If you go home with a Polar Care machine, we recommend freezing 8 plastic water bottles. This keeps the water cooler longer than bagged ice, and your home refrigerator will not be able to keep up with the amount of ice needed. By freezing 8 water bottles, This makes sure that you can have 4 frozen bottles in the machine and 4 in the freezer ready to swap out. What to expect from therapy after surgery. Our goal is to have you moving within 4 hours of arriving to your inpatient room. We keep you safe and prevent falls by using this gait belt and chair and bed alarms. Physical therapy, otherwise known as PT, and occupational therapy, otherwise known as OT, will help you understand how to successfully move with your new joint, have balance and be mobile, increase strength through exercise, get dressed safely, move in and out of beds and chairs, get to and from the bathroom safely, and climb up and down stairs. On 5 East, we have our inpatient rehab department. We have a variety of stairs for training with patients prior to discharge. Necessary equipment. Total hip and total knee replacement patients will require a 2-wheeled walker. If you do not have one set up prior to your day of surgery, we will work with case management on getting you a walker. Reverse total shoulder replacement patients will need to be fitted for a shoulder immobilizer before surgery. Bring this with you on the day of surgery. Total shoulder replacement patients, your shoulder immobilizer will be given to you at the hospital. Other equipment that you may be interested in includes a shower chair or a shower bench or a toilet seat riser with arms. You can purchase these options at local stores such as Walmart or online at Amazon.com. Our case management team can also help get this set up and delivered to your house. However, that tends to be a little bit more expensive. Pain management. You should expect to have some degree of pain after surgery, but we work as a team with you to manage your pain. You will be asked to rate your pain on a scale from 0 to 10, and different types of medications are given based on your pain score. Pain medication is best taken before your pain becomes too severe, so please communicate with your nurse if you need something for pain or if you are not getting enough pain relief. If you take narcotic pain medications before surgery, it may make it more difficult to control your pain after surgery. We will work with you to help manage your pain. Discharge planning starts now. We will discuss many instructions with you, such as activity precautions based on your surgery, preventing blood clots, incision care, new medications at discharge, ice therapy, driving, and follow-up appointments. A few reminders we want to give you: if you have pets at home, make sure they are not sleeping with you while your incision heals. Also, please wait on any outdoor activities such as mowing the lawn or using a chainsaw until your surgeon clears you. Each surgeon will give you specific instructions for your dressing. Your dressing will be waterproof and you will shower with it on. No tub baths or being submerged underwater until cleared by your surgeon. Follow your surgeon's instructions about when or if you can remove your dressing. Although these are not St. Mary's patients, here are some examples of bruising and swelling after joint replacement surgery. Please pick up your medications on the way home at discharge. Our hospital pharmacy is wonderful to use, and you can pick up your discharge medications to prevent an extra stop on the way home. Speak up if you have any questions about your discharge instructions when your nurse is educating you. The program coordinator will call you within a week of discharge to check in on you. Please call the program coordinator or the surgeon's office first if you are having any problems or if you have questions. Working with therapy is the key to a successful recovery. Make sure you are following their instructions and exercises, along with following good nutrition and staying hydrated. Reasons to call your surgeon's office or the program coordinator: if you have signs of a wound infection, such as redness, warmth, draining, pain, swelling, or an odor. It is common to run a low-grade temperature after surgery for about a week after, but any fevers that are above 101.5 degrees or higher for more than 24 hours, an increase in pain, swelling in your arm, leg, or knee, any abnormal feeling or concern, and if you are having trouble breathing or chest pain, please call 911. You can call this number listed below to find out what your potential copay will be. You will need some information when you call, such as your name, insurance information, and what your scheduled surgery or procedure is. Thank you so much for listening to our joint replacement education class. This class should help prepare you for your upcoming surgery. We are excited to take excellent care of you. Please reach out if you have any questions.